Hello, I'm Dr Ian Strawford and I'm a cosmetic doctor and I am the medical director of Skin Excellence Clinics in the UK.
What are exosomes?
So let me tell you about exosomes, because this is, I think, a very, very exciting and groundbreaking treatment. And I think exosomes themselves are going to be the future of regenerative medicine and treatments not only for aesthetic reasons within the skin or the hair and tissue regeneration, but possibly in the whole of medicine and surgery and even vaccines and chemotherapy, anti-cancer agents of the future. So what are exosomes? So exosomes, all cells produce exosomes. And exosomes are little vesicles or little bubbles that are released from cells that contain many, many different messengers, chemicals, messenger chemicals that talk to other cells. So it's a way of our cells talking to other cells within the body. So every exosome has specific functions in terms of it talking. And so in this case, we're using the power of certain exosomes that are exosomes from what are called mesenchymal stem cells. So these are, in this case, adipose or fat cell derived stem cells. Now, stem cells are in our body. Stem cells are what make all the other cells. They become other cells. So the messengers that come from that can be used to stimulate all sorts of cellular activity. And so specifically, we're using these mesenchymal stem cells, adipose derived ones, specifically because they're the ones that have the messengers in that talk to skin cells. To talk to skin cells and stem cells within the skin to produce new skin cells, to affect increase the effectiveness of the existing cell's structure. They reduce inflammation through pro-inflammatory, anti-inflammatory pathways. They stabilize melanocytes, the pigment cells. So they have multiple functions in the skin specifically in this case.
How are they administered?
So exosomes are in a fluid, cell-derived fluids, effectively. So how we administer them is interesting because in some countries they can be injected. They're allowed to be injected into an area of the body, into the skin. But because they're from human-derived stem cells, there are laws and regulations around the use of these vesicles and stem cells effectively. And so certainly in the UK, they can't be injected technically. We can't inject them with a needle and syringe. But they can be administered what we call transdermally. So if we put exosomes on the skin, they will very, very slowly penetrate the skin, although that process is not a very efficient mechanism of getting those exosomes into the area where they're going to be most effective. But what we tend to use is what we call transdermal delivery systems, so ways of getting those exosomes through the skin barrier itself. So we can either do a microneedling process, which we do with lots of things, where we'll microneedle the skin, little fine needles, which will, for a short while, make the skin porous and affect that anything we put on the skin, whether it's mesotherapy or topical PRP, or in this case, the exosomes will pass through into the skin. That's certainly one effective way. The other effective way that we're going to be using them in Skin Excellence clinics is with a treatment called TICSL, or thermomechanical ablation, as it's better known. And we know that with heat at the very low settings, where we're not creating an ablation of the surface layer of the skin, but the heat will cause something called open channel or nanopores to appear. Now, these are little passages through the skin. And in this case, the passages are much more effective than just needle punctures. And those nanopores will allow the full passage of the exosomes. And those actually nanopores, we know after a treatment with TICSL, will stay open for a number of hours, So we can apply the exosomes, we can place a mask over the skin with more exosomes in that will maintain them, exosomes going through the skin. And I think that's a really effective way, what we call a transdermal delivery system. So various ways we can use, and this will be very, very powerful way to use these incredibly powerful and unfortunately expensive serums of exosomes.
Can exosomes help with hair growth?
Exosomes for hair growth. Well, that's a really interesting area. Definitely they can help, not only in improving the function of the existing hair follicles, but there is some evidence that they can help new hair follicles grow where they are not. So that is going to be really exciting because this could be a way of bringing new hair follicles to areas of the scalp that's denuded, maybe from male pattern baldness, maybe through other diseases such as autoimmune alopecia or alopecia areata. There's some good cases showing the regeneration. So this is really, really exciting stuff. I think this is probably the one thing that I've seen powerful medicine being used now in our speciality.
Is the treatment painful?
So when we administer exosomes, if we're doing a dry needling or a micro needling, then as we do normally, we've placed anesthesia on the skin, and it's a pretty painless procedure. And then if we're using Tixel treatment to create these little nanopores and the mesoabsorption of the exosomes, then again, that's a heat treatment, but with local anesthetic cream, it's absolutely painless. So pretty much all of the way we're currently administering exosomes are painless treatments.
Are they safe to use?
Exosomes are safe, and there's lots of research and science around exosomes. They're being used widely, or being certainly ways are being explored in medicine as a whole on how best to use exosomes. So as I said, this is truly regenerative medicine or targeted medicine in some cases when it comes to drug delivery using exosomes. So in a way, there's a lot of research going around at the moment around exosomes, and there's nothing to say that exosomes are not safe. I've not seen any literature or any evidence that shows that exosomes increase the risk of cancer. In fact, they're actually being explored in the use of exosomes in treating cancers. So at the moment, we believe exosomes are an incredibly safe treatment.
Do you need a course of treatment?
So a course of treatment is usually recommended when we're doing regenerative treatments, whether it's to try to stimulate scalp hair production or improvement there, or whether it's treating the skin from an aging perspective or from sun damage or scarring. Then the more we need to gain from these treatments, the more likely it is that we will need a course of treatment. So we're working with different protocols, but most people need a course of at least 3, if not 4 or 5 treatments to see these significant changes that we're seeing with the use of this therapy.
Will they work in combination with other treatments?
As I said, we explore lots of ways. So the way we're administering these treatments, these exosomes, is in combination, i.e. with a microneedling procedure, which we know is effective in one way, or with a Tixel treatment, which again is effective as a standalone treatment. So combining them. I'll also be combining them with other fractionated radiofrequency treatments, whether that we mean radiofrequency needling, which is in our clinic using the class-leading treatment of Morpheus 8. So we will be combining them as well with Morpheus 8, because following this treatment, there will be an enhanced penetration of the exosomes immediately after the Morpheus 8 treatment. And I think, yes, using them synergistically with these other treatments, we're going to see even better results than just using them on their own.
Can you sum up exosomes and what they mean to you?
Exosomes, as I've said, I'm so excited about exosomes. I think they really have incredible power to transform our skin and other areas of the body And I think they really are going to be the future of regenerative medicine, certainly regenerative skin medicine. And let's watch this space. I know they're being hotly talked about. Every international and UK conference I go to now, they're taking a bigger and increasing part on the agenda, because really we're all excited about these tiny little particles that are coming from stem cells. And I think this is really, really exciting times. And hey, watch this space for more information.